everyone. I am Pastor Pass, the senior pastor at Brighton Rock AME Zion Church in Portsmouth, Virginia. Once again, I want to say thank you for joining us in our fight against COVID-19. As we continue to spread the news, to spread the awareness, to spread continuous education around COVID-19, we are partnering with healthcare professionals across Virginia to share in this fight against COVID-19. Today, I am pleased to share with you our special guest. She's a nurse, over 30 years of health care professional experience. She's a registered nurse employed with Centera Princess Anne Hospital, and her name is Erica Goodman, and she is going to be our panelist guest today. Joining us on our panel discussion is going to be Deborah Carlos, who is a professional doula in the area. We're glad to have her as well as Deirdre Sanderlin, who is the CEO of My Plan D Events. We're glad to have her. Also, Fran English, who is a retired professional nurse in the area, as well as our Norfolk president of our WH and OMS Society. And also sharing with us today on our panel is Miss Sue Wilkerson, and she is a retired corporate executive with QVC. They're going to join in with a discussion today talking about masks, the importance of wearing a mask and all that goes with that. So let's welcome them and join in the discussion today.
Okay. All right. So I know I'm excited to talk to a superstar with COVID, right? That not with COVID, but COVID experience and doing all these great things in the community, working with people and helping people get through this pandemic. So since we all know it's a pandemic, I'm really wondering, how are you doing with all of the COVID stuff, and how does that affect your job? Is it overwhelming? And I'm sure it is, but I'm gonna let you answer that. Exactly. How are you handling and navigating that, and how is that affecting you and your position?
It's been difficult these last 2 years dealing with COVID in a professional setting such as healthcare. I deal with outpatient procedures and outpatients themselves, so it hasn't affected me as much as it has my counterparts, my professional nurses that are bedside. I used to do bedside years ago. I got out of that. And so now I do outpatient. So it hasn't affected me as much as it has my counterparts, my fellow nurses that are still doing bedside and floor nursing. Initially, when the pandemic first hit, our department did shut down for 5 weeks. And being that I'm the team coordinator in my department, I had to disperse my staff to the hospital. To assist with the surge the pandemic brought about. But after about 5 weeks, I did get my staff back. But it has affected my hospital. When we have surges, we have a bed shortage.
Right.
When we have a bed shortage, that puts it puts our community at risk, because you have people with other health issues we're not able to treat because of the bed shortage. So when we have a surge in this pandemic, we see areas where we're not able to treat patients in our community that have other health issues. So that is a primary concern for us. Just recently with this last surge, because of the bed shortage, we actually had to stop our surgeries. We had to shut down our surgery department, and we could only do emergency surgeries that we had scheduled. We had to cancel because we had to make room in the hospital for the patients that came in positive for COVID-19 and needed beds. So all of the surgeries that we had planned and the admissions had to be canceled due to the surge. So every time there's a surge, there's a bed shortage. And therefore, we put our community at risk by not being able to treat other health conditions.
You've mentioned the community, and I can understand that your heart bleeds for the community because it comes through. So we're talking about the community, but I want to go back to the initial question about how is it affecting you in your job. So I guess I'm going to be a little bit more clear. mentally it has to be exhausting
It is
for you. So I
exhausting.
wanted to know how that affects you and I guess your team mentally in your job. How are you doing that? How are you navigating through all of this stuff and still being the bright shining star that you are, talking about the community?
Thank you. It's it's exhausting.
Mhm.
It does affect my department because, like I said, we're an outpatient department.
Mhm.
So I have a schedule of patients on a daily basis. It's affected my department because we've seen a decline in the patients that we treat
Mhm.
because with this latest surge, we've had so many patients that have been positive for COVID.
Mhm.
Not only with my patients with this surge are positive for COVID, but my staff as well. I've had a
Mhm.
number of my staff, well, all of my staff except for me, have tested positive for COVID at one time or another. So I've had to work with a skeletal staff
Mhm.
at times. Just getting through has been trying. It's been difficult. It's
That's
been
the answer I'm
stressful.
looking for. Yes. Yeah, because we know that we all like to think that we're super people,
Yeah.
superhuman, but those same um, challenges that are in families are the same challenges I'm sure that you and your staff have experienced mentally.
Yes.
Yeah.
Yeah.
Okay.
Mental health is a big issue now among the healthcare professional community.
Mm.
Unfortunately, I am seeing a lot of healthcare staff getting out of the industry because they are burned out, mentally exhausted, and going through a lot of healthcare issues.
Okay. Thank you so much. I appreciate that.
Welcome.
Nurse Goodman,
Yeah.
kudos to you and your staff for all that you are doing during this pandemic. I have a question I want to ask you. Are you seeing any issues or you have concerns about anything that is happening now that make you to be very concerned about?
Well, my biggest concern, and to reiterate, is the number of healthcare professionals that are getting out of the profession because of burnout, because of being exhausted, and not having the support that they think they need during this pandemic in order to get their job done. So that's been disheartening to see our healthcare professionals leave the profession because of that reason.
And can I ask you, are they leaving from bedside care and going maybe into like administrative duties, those that you're seeing, or are they just leaving nursing completely?
They're leaving nursing completely. They're not going into administration. They're just leaving the profession as a whole. They, again, nurses that I've spoken with, those that I've read about, that I've seen interviews, they just feel like they don't have the support these last 2 years during the pandemic to be able to do their job effectively. They feel like they don't have the supplies that they need to be able to do their job effectively, and just no support from administration. They feel like they don't have backup, and anyone to talk to about the stress that they're enduring during these last 2 years.
Okay, thank you so much.
Um,
Know how to wear your face mask correctly. First, wash your hands with soap and water for at least 20 seconds or use hand sanitizer that contains at least 60% alcohol. Put your face mask over your nose and mouth and secure it under your chin. If the mask has loops, hook them around your ears. If it has ties, secure them at the base of your neck and crown of your head. Make sure you can breathe easily. Remove your mask carefully. Untie the straps or unhook the loops from your ears and pull the mask away from your face without touching the front of your mask. Don't touch your eyes, nose, or mouth when taking off your mask. Wash your hands for at least 20 seconds immediately after removing your mask, or use hand sanitizer that contains at least 60% alcohol. Learn more at cdc.gov/coronavirus and coronavirus.gov.
And let me just ask you one more question
Yes.
then while I have you up here. Is there any benefit at all in wearing two masks, or just wear one mask? What are you seeing?
Okay. The only benefit to wearing two masks is if you wear a disposable mask underneath a cloth mask. If you have a cloth mask, and I'm not against cloth masks because any type of mask is better than no mask at all. But if you have a cloth mask that's made of a very thin material that light can go through, or if you have a cloth mask that is only one layer and there are no added layers and no filters, then you need additional protection. And that is the only reason you should wear two masks is if you wear a disposable mask, which has a filter in it, a disposable procedure surgical mask, beneath a thinly veiled cloth mask, a thinly layered, I should say, cloth mask that doesn't give you a lot of protection.
Okay. Thank you so much.
Nurse Goodman, I want to follow up to that question. Do you think that, or should people who have been vaccinated, should they continue to wear masks? And in that same vein, is two masks better than one for vaccinated individuals?
Now, according to the CDC, fully vaccinated people don't need to wear a mask outside if it's not a crowded area and you allow for social distancing. However, if you're in an area that have high numbers of COVID cases and it's extremely crowded outside and does not allow room for social distancing, if you're fully vaccinated or not, you still need to wear a mask outside. In addition, if you have a weakened immune system due to medication or a health condition, you still may not be fully protected. Even though you are fully vaccinated, you still may not be fully protected. So in that case, you also still need to consider wearing a mask because you're not fully protected. You still need to take the precautions and have a discussion with your primary provider about masking. And in that case, again, two masks are not warranted unless you are wearing a disposable mask beneath a cloth mask.
Okay. That's good information. Thank you.
You're welcome.
Well, Nurse Goodman, I see by all of your comments and your response, obviously you are a proponent for wearing masks.
Yes, ma'am.
So what are your views in terms of all of the ongoing debate and differing opinions about wearing masks? So the significance, if you were to talk to a group that was on the fence, what would you say to them?
I would say masks work. These last 2 years, speaking from personal experience, and from what personal experience and my experience over the last 30 years. I used to be a floor nurse, and I've worked with patients where, let me backtrack a little bit. Healthcare providers didn't just start wearing masks 2 years ago when the pandemic came about. We've been wearing masks for years. Surgery is one good area where we wear masks, and patients that are in isolation, we wear masks where we may be susceptible to whatever they have. Masks, I'm not on the fence. They work. The last 2 years, as I said, we've been in a pandemic for 2 years. Because I wear masks and I wear them appropriately and I follow the guidelines, thank God we have managed to keep COVID out of our home these last 2 years. I encourage my husband and my children never to leave home without masks. So I am an advocate for masks. Masks are made to contain droplets and particles that you breathe, you cough, you sneeze out of your body. So if you have a mask that you are wearing and it fits correctly, closely to the face, it can provide you with that protection from other people that may be sneezing, coughing, breathing out particles. Not only are you protecting them, but they're also protecting you by wearing a mask.
Right. So I have a question. What would be the justification for someone to not wear a mask during the pandemic?
Like what reason would
Into the CDC, and I do follow their guidelines closely. The justification for not wearing a mask temporarily: eating, drinking, taking your medication. In addition, if you have to ID yourself to law enforcement, that is a justification for removing your mask temporarily. In addition to that, if you have someone that is hearing impaired and they need to communicate with you by reading your lips, then that is justification for removing a mask. However, masks for the hearing impaired have been developed, and we do keep this in our department as well, so that this mask, you're allowed to see the person's lips, and if someone is hearing impaired, they're still able to read your lips. So those are the justifications for not wearing a mask.
You know, I see people wear all different types of masks, and this is the first time I actually seen the mask that looks like that. I've seen the face shields, the clear face shields, and you know, the ones that people make at home. But I know those aren't the ones that you wear in the hospital or in a clinic or anything like that. So what would be the most effective type of mask to wear?
Like I said, masks can provide different levels of protection,
right?
Depending on what type of mask you choose. I'm going to start with cloth masks. And again, I'm not against cloth masks. Depends on how well that cloth mask is made. For example, if you choose a cloth mask that is only made with one layer or light can get through it, that provides the least level, maybe like a mask similar to this, that provides the least amount of protection. If you choose a cloth mask, choose a cloth mask that has a nose wire in it that you can fit on your face. It is well made. It is not loosely made. It has added layers of protection in it. And you can slide a filter in it. You can wear this type of cloth mask that gives you a little bit more added protection than one that's thinly made. Next, you can also use for more added protection than those two cloth, you can use what we call a procedure or a surgical mask that also has a nose wire in it. It is layered and you are able to fit it closely to your face. That gives you more protection than either the cloth mask. But for the best protection at all, overall, is your N95. But this is a fitted mask where you have to be measured in order to use it. And this is really advocated for patients, for staff that are actually taking care of patients that have COVID-19, or you're doing any type of respiratory care on a patient, or if you're in a surgical case where the patient has to be intubated and extubated, then this mask is highly recommended and the most effective against COVID-19.
So could you get those on Amazon? I'm sorry, Miss Sue.
No, go ahead.
I would say, can you get the N95 mask like on Amazon or?
I would be very careful. If you're ordering the N95s from Amazon, you really need to do your research. I've never tried to order N95 from Amazon because I do work at a healthcare facility where they are provided for the staff. But I would do my research to see exactly who the manufacturer of an N95 is before you go on Amazon to actually order one, because there are fake N95s out here and may not give you the protection that you need.
Okay.
Well, I just had a follow-up question because you gave some very good information in terms of showing us the kind of mask and giving us examples. I wonder, how frequently should we change masks?
Good question. If you are wearing a cloth mask, you need to change that mask, wash that mask daily. Change it sooner if it becomes dirty, if it becomes saturated, wet. You need to change it immediately because it offers very little protection. With disposable surgical procedural masks, you need to change them daily as well. If they become saturated. If they become wet, if they become dirty, change it sooner. And always wash your hands after touching any used masks. Those masks may have particles, may have droplets on it. And if you touch that used mask and you touch your eyes, your nose, your mouth, you may be transmitting that virus into your body. So immediately after removing your mask, wash your hands before touching a clean mask.
Excellent information. Thank you.
You're welcome.
So since we've been talking about masks, Ms. Goodman, I know you've been following the political propaganda, if you will, on whether or not students should be wearing masks in school. And I know that the courts have overridden the local government, the state government's decision to say that that the parents, it's their decision whether or not they should wear them. What's your opinion on that, about the students in classrooms wearing masks and having the decision, having the power to say whether or not I can come in and wear a mask or not?
Thank you for that question. I have a teenager that is still in high school. When the new governor decided to lift the mask mandate and say that the parents had the option of sending their children to school without masks, I immediately told my daughter, no. As long as we're still in this pandemic, and we were in the height of the pandemic when he took office, we were in a surge. I informed her that would not be the case in our household. She would still have to wear a mask to school. Yes, parents have the right to educate and tell their children what they feel is right. But being so in the thick of this pandemic as a healthcare professional, I still think we need to look out for our community. We still need to look out for our teachers. We barely have teachers as it is. They're getting out of the profession like healthcare providers. So I still think we need to look out for our children, our teachers, and wearing masks right now, I think, is the way that we fight against this pandemic, is one of the ways that we fight against this pandemic. So I am for masks. I am for wearing masks in school to protect our teachers, our educators, as well as our fellow students.
Thank you. You answered that. So I guess my summation would be, parents have the right to educate their children.
They do.
And this is me talking, so this is what I got from it. You let me know if I'm wrong. But parents don't necessarily have the right to put other children and the teachers and the other staff at risk.
Exactly.
Okay.
Well said.
Well, I just want to thank you guys for joining us today. Thank you for visiting us today and having this wonderful chat about wearing your mask. Hopefully, we've answered some of your questions about COVID. And if not, please enter your questions in the chat so we can follow up and answer those questions on our next forum. So join back with us on April 27th as we talk about COVID and as it pertains to our youth. So thank you and have a wonderful, wonderful day.
Thank you.